Good evening, everyone. It's Saturday, 5th of January 2013. We're going to have a little session this evening on anatomy and physiology, specifically looking at the vascular shunt mechanism, or otherwise known as the redistribution of cardiac output. So the main theme of this session is we want to know, if I draw in a pretty little heart there, we want to know where does the blood go from the heart, and by the blood, of course, we mean the cardiac output, the quantity of blood leaving the left ventricle per minute. Where does it go to during resting and exercise conditions? Well, first of all, let's just look at a very, very simple illustration. During rest, we have the vast majority of our cardiac output being directed towards the general or other tissues of the body, and a small proportion of that cardiac output being directed to the muscle tissue. So we're saying that by far the vast majority is going, nice thick line there, is going to the rest of the body or to other tissues. But if we begin to exercise, this situation reverses, and we find that during exercise the vast majority of cardiac output is redirected towards the muscle tissue or towards skeletal muscle, and that only a small proportion of cardiac output is directed towards other tissues. So the question is, how does this process occur? How do we shift the direction of the blood we are ejecting from the heart from other tissues to the muscle tissue? And that's what we're going to try and answer today by looking at the vascular shunt mechanism. I'm usually to present that there are two primary mechanisms that allow this process to operate, and those two mechanisms are initially that we have the vasodilation, so I'm writing here, and vasoconstriction. So just about fit in. Of arterioles, which I'll explain in more detail in a moment, of arterioles, but also that we have the vasodilation, which is a long old word, and vasoconstriction of pre-capillary sphincter muscles. And the main